This is Mayor Ken Tedford, and I'd like to call this meeting of the Central Nevada Health District to order. First item on the agenda, item 2, is to pledge allegiance to the flag.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Has the agenda been posted in compliance with NRS?
Yes. Amber Edwards, for the record, verifies that the agenda for this meeting was posted on or before the 10th day of April 2026 between the hours of 3:30 p.m. and 5 p.m. at all the locations listed on the agenda.
Okay, thank you. Amber, could you take roll?
Chair Ken Tedford,
Here.
Bob Erickson,
Here.
Denise Ferguson, Don Witten, Jeb Rowley,
Here.
Brandon Chaddick, Connie Gottschalk, Tony Roos, Dr. James Zubردis, Nicole Cooley,
Here.
Matt Hyde,
Here.
I think that leaves us 6, so we have an agenda, or we have a quorum for this agenda. So we'll go to item 5. Don Witten is present now also, so that makes 7. You can correct the record, Amber. We'll go to item 5, which is public comment, general in nature, not relative to any item on the agenda today. Discussion can be held, but no decision can be made. Is there any public comment? Hearing none, we'll go to item 6, consideration and possible action concerning approval of the minutes for the meeting held on 3/4/26. Are there any corrections or additions to those minutes? If not, I'd entertain a motion to approve those minutes.
Mr. Chairman, Bob Erickson for the record. I would move that we approve the minutes for the meeting held on March 4th, 2026.
Matt Hyde, and I'll second that.
We have a motion, we have a motion and a second to approve those minutes. All in favor?
Aye.
None opposed? Minutes have been approved for 3/4/26. We'll go to item 7 on the agenda. This is a public hearing for adoption of environmental health and clinical services fee schedule, which is effective the date of July 1st, 26. Is there any discussion on this public hearing?
Just a comment to make from Eureka anyways. We dearly appreciated Shannon coming down previous board meeting and was able to educate some of our county leadership on the where things were going with these rates. I think they've looked at this closely, and just one thought of clarification was that we had talked a little bit about the state fees that had also have been changing. Can you refresh my memory how that contrast was with like the state and their percentage of increase versus what is proposed here?
Shannon Ernst, Administrator for the record. So the state is working on revising their fees, and also so is Northern Nevada Public Health. When last time I spoke to Northern Nevada, they are going to have a significantly higher increase than we're proposing on ours at this time. And like mentioned, this does not cover 100% of the cost of CNHD to provide the service, but it's our goal over the next 3 years to align this. We wanted to reduce the impact to the individuals that obtain these fees access the clinics at this time.
No, thank you. And Jeb Rowley, for the record, again, I think that was very helpful information to the jurisdictions and partners to kind of see how others were looking at this as well. And I felt that we were able to take away that this is what we're seeing across the board, and it's consistent, it's reasonable, and I appreciated that context delivery.
And
Thanks.
again, for the record, Shannon Ernst, it was a big conversation since last March. The plan was for CNHD to have done this 1 year after the launch. And so as soon as I came as the interim role, I started meeting with the other health authorities. Carson City is not a health district, so we were meeting as authorities and discussing what they were doing, what they were doing in the future, and what those impacts were. How are they doing their analysis? So we could all kind of be consistent across northern Nevada. And so this has been being evaluated through that whole time. Maria and Kathleen Patterson worked very hard on coming up with those projections, so then we could look how we can implement over that 3 years.
Any other discussion? And if not, Jeb, does your discussion lead to a motion?
It does. I just need to get that back in front of me. Yeah, Jeb Rowley, for the record, with motion to approve the CNHD fee schedule effective July 1, 2026.
For the record, Dawn Witten, I second that motion.
We have a motion and a second. Thank you. All in favor?
Aye.
Aye.
None opposed? None opposed? The motion and the second has led to the passage of the Environmental Health and Clinical Services Fee Schedule effective July 1st, 2026. We'll go to item 8, consideration and possible action concerning ratification of the letter of support for Mount Grant General Hospital Non-Emergency Medical Transportation Department. Shannon.
For the record, Shannon Ernst. So Denise Ferguson contacted us about obtaining a letter of support to apply for the Rural Health Transformation Grant Program. They found within their community that really non-emergency medical transportation services were needed. This does align with the priorities that we have seen for that community, and so I did provide that letter based on the fact that grants are coming due. So today I'm just asking that to be ratified.
Any questions or discussion on this item? If not, I'd entertain a motion.
Bob Erickson, for the record, I would move that we ratify the letter of support for Mount Grant General Hospital Non-Emergency Medical Transportation Department.
Matt Hyde, second.
We have a motion and a second. All in favor?
Mr. Chairperson, Cecilia
Oh,
Blue,
I'm
and I'm
sorry.
the Assistant DA for Churchill County. If I can just get you to open it for public comment
Yeah, I'm
before you
sorry.
vote on each action.
Yeah, I'm sorry. I forgot to do that. Any public comment on item 8? Being none, back to the council. We have a motion from Bob and a second from Matt. All in favor?
Aye.
None opposed? Motion carries, and the letter of support can be given to Mount Grant Hospital. We'll go to item 9, consideration and possible action concerning ratification of a subaward grant SG-2026-00406 in the amount of $6,942 between DHHS, Division of Public and Behavioral Health, and the Central Nevada Health District for personnel to provide STD screening and treatment and prevention services.
For the record, Shannon Ernst. So we have been awarded the $6,900. This just helps increase supports to CNHD for our STD program. Really, the main impact is for our epidemiologist program within disease investigation, which Victoria Sepsic oversees. If there's any questions, I can answer.
Any questions from the board or any questions from the public? If no questions, I'd entertain a motion.
Mr. Chair, may I, for the record, I move to ratify the subaward grant between DHHS, Division of Public and Behavioral Health, and Central Nevada Health District in the amount of $6,942 to provide STD screening, treatment, and prevention services.
Nicole Cooley, for the record, I second that motion.
We have a motion and a second. All in favor?
Aye.
None opposed? None opposed, so the motion and a second carries, and we have ratification of the sub-award on item 9. We'll go to item 10, consideration and possible action concerning ratification of a sub-award between SG-2026-00446 in the amount of $32,998 between DHHS, Division of Public and Behavioral Health, and the Central Nevada Health District to establish healthcare associated infections, HAI, activities and specific to Churchill County, 1/1/2026-731/2026. Any questions from the board or the public on item 10? Yes, Dr. McDonald? Need you on the record, please.
Dr. Ted McDonald, for the record. Is this item specific to Churchill County or specific to all the counties of the Central Nevada Health District?
Shannon?
For the record, Shannon Ernst. So they named specifically in Churchill County on it and under the motion, but it does say within Central Nevada Health District. So we will obtain clarification for the project, and this is one of Victoria's projects. So we'll be working district-wide.
Well, it's posted as Churchill County, so
That's what it
that's
says
a
on that.
problem.
I'm sorry, sir.
That's going to be a problem if it's for all the counties, because,
So the grant, they marked it on there for Central Nevada Health District area, but then they also just wrote in Churchill County in the language. So is what we get to do is go back, and when we have our first meeting with them, we get verification that it is all for CNHD.
well, what do you want to do here? Ms. District Attorney?
If you'd like to table the matter as an action item until your next meeting, until you get clarification, that's fine.
Well, it's up to you. It's posted Churchill County, and it may say all counties, I don't know, and it may only say Churchill County, I don't know.
So this happens a lot with CNHD's items because they can only put, like, right in one county, but they know then CNHD. So we wrote within, what they go by is our scope of work. If you read our scope of work that is attached to this, it says for all counties. And so we list the counties that are all partners. And so that's what they usually go by. We have not had an issue with this saying Churchill County in the past.
I believe based on Shannon or Ms. Ernst's representation, particularly with regard to the scope of work, you would be okay voting on the action item because it sounds satisfactory that it represents all counties pursuant to the scope of work, and that is what they would follow in the contract.
Okay, I'm good with it then. Any other questions from the public and/or the board? If not, I'd entertain a motion. All
Mr.
right.
Chair, Jeb Rowley for the record with a motion to ratify the subaward grant SG 2026-00446 in the amount of $32,998 between DHHS, Division of Public and Behavioral Health, and Central Nevada Health District to establish healthcare-associated infections activities specific to Churchill County, but also mentioned to follow that scope of work.
Matt Hyde, I would second that motion.
And are you willing to amend your motion to say between 1/1/2026 and 7/31/2026, Jeb?
With that amendment, 1/1 of '26 to 7/31/2026.
And Matt?
I would second that with the amendment.
Okay. Thank you. All in favor?
Aye.
Aye.
Any opposed? That motion carries, and that subaward has been approved on item 10. We'll go to 11. Consideration and possible action concerning ratification of a subaward SG 2026-00447 in the amount of $53,441 between DHHS, Division of Public and Behavioral Health, and Central Nevada Health District to enhance HAI activities specific to Churchill County, 1/1/2026 through 7/31/2027. Shannon.
So for the record, Shannon Ernst, this is just as the same as the project previously presented, but as you'll notice, we received additional funding and it goes for a longer period of time. This is based on how the funds are awarded to the state to allow us to provide these activities. If there's any questions, I can answer.
Ms. DA, are you giving the same recommendation on this?
If it's within the scope of work that it applies to all of Central Nevada Health District, then yes, I would give the same recommendation.
Okay, thank you. Any questions of the board or the public on this subaward? Being none, I'd entertain a motion.
Mr. Chair, I would move to ratify subaward SG 2026-00447 between DHS, Division of Public and Behavioral Health, and Central Nevada Health District in the amount of $53,441 and activities specific to Churchill County with the Central Nevada Health District added to that, 1/1/2026 through 7/31/2027.
Thank you. We have a motion. Do we have a second?
Dawn Whitten for the record, I second the motion.
We have a motion and a second. All in favor?
Aye.
Aye.
Any opposed? Being none opposed, that motion is carried and that subaward has been awarded. We'll go to item 12, consideration and possible action concerning ratification of subaward SG 2026-00412 in the amount of $89,997 between DHHS, Division of Public Health, and Central Nevada Health District. The funds will support Nevada's influenza A/H 5N1 response efforts as well as preparedness activities, capability building, and sustainment for other threats of disease outbreak. Shannon.
For the record, Shannon Ernst. We were previously awarded these funds. It was a very short time frame, and so this is kind of unusual. We didn't receive any more funding, but they did extend the grant. So they came back with a whole new award of those funds. So this is a little different than we normally see. So I'm bringing it for you for this ratification. So Victoria, our epidemiologist, and her team have been providing activities already for this grant, and she will talk about those in her updates. I will not steal her thunder because they are doing great work. So we're just asking to ratify this, and we'll continue with the activities.
Okay, any questions from the board or from the public on item 12?
Mr. Chair, may I make a motion?
Yes.
Jeb Rowley for the record with, I do this all the time, motion to ratify subaward SG to 2026-00412 in the amount of $89,997 between DHHS, Division of Public and Behavioral Health, and Central Nevada Health District.
Thank you.
Matt Hyde for the record. I'll second that.
Thank you. We have a motion and a second to approve this subaward. All in favor?
Aye.
Any opposed? Being none opposed, the motion carries and this subaward has been approved on item 12. We'll go to item 13. Consideration and possible action concerning the review and approval of the submittal of the proposed projects for submission to the Rural Health Transformation Program Flex Spending Round 1, including the remodel of 290 South Main Street in the amount of $3,100,000 to support future district operational capacity. Number 2, program to support community health workers to expand outreach services in the amount of $250,000. And number 3, the lease of an on-med telehealth station for Crescent Valley in the amount of $1,800,000 for a 5-year term. Shannon.
For the record, Shannon Ernst. At our previous meeting, we discussed the Rural Health Transformation Fund, and I want to bring forward and make sure that I actually submit these in the rankings and projects that you would desire. I propose that the first project we bring forward is the $3.1 million to remodel 290 South Main. That property was purchased for the use and future growth of CNHD. At the time that it was purchased, there was not enough funding to do that remodel, and so then it has been sitting there vacant. Under this, I was concerned because it does have a word of minor rehab, but I received clarification today that due to the fact it does support such a large area, the 4 counties, and the overall need of CNHD, that they see that it would be accepted by the committee and then go on to CMS. The second project I'm bringing forward is the goal of getting our community health workers the training and expertise so that they are Medicaid billable. This builds our revenue sources and the sustainability of that program. Further, we'll have to make some changes to our EMR to allow for the billing for these community health workers. And the projected cost for that is $250,000. The last one is a very unique opportunity that has come up. The president of BRK Nevada reached out to me about these new telehealth centers, and you have in your packet really the overview of these. And I've seen a lot of telehealth centers, and I was very curious, and so I met one of his associates in Reno, and there's one located at the senior center there. I was able to experience going into it's not a building, it's a room within a room. And it locks down, and a woman comes up on the screen, and it's not a computer-generated AI, it is actually a woman that was there. We talked through why I was there. She did my intake, just like if I was sitting across from you. And then she said, we went through our needs. She did my vitals. It came from the sky. It took my heart rate. It took all the things. You just added them on. It was amazing. The goal for these is really to reach areas that do not have healthcare or lack the workforce to be able to provide it. So very rural communities. And the first thought came to my mind was Crescent Valley. Crescent Valley is a unique situation in the fact that you have very passionate community members. They want services, but to provide service there, it's very costly, especially primary care. This is provided from 8 o'clock in the morning till 8 o'clock at night. And when it's not in use, it locks down so no one can go in it. So I actually reached out to board member Cooley and board member Raleigh and asked them if they thought this would be of interest. So on Monday night, I presented this to their medical health committee that is in Crescent Valley. They were very excited. Actually, they were ecstatic, I think. It was because it is one of these centers that is not just seeing a doctor when nobody is there, but if you need specialty care, they will actually link you and help coordinate that care. The only thing it lacks really is lab services. So the group there is taking this to the Board of County Commissioners. The hard part with this whole situation is everything is due on the 30th for round one. That is approaching quickly. And so we are coming up with seeing if they can get a letter of support for this project by the 30th from Eureka County. Definitely, we do not want to bring something into a community that the community does not want or the leadership there. And so that's where I have been working with them. And if there's anything the board members would like to add, it is very costly. It costs $30,000 a month for this machine. So we could apply for this for the 5-year term, which would equal $1.8 million. The question came up, what if people do not utilize it? Does it just sit and get unused? No, I think we look at it, if we are awarded these funds, we look at a defined time, see what the utilization is, and if it is low, then maybe we identify another community. If utilization is high, then I think we apply for more and other communities that would like to see it. But that's a conversation with each community. This is kind of like a pilot for CNHD and utilizing Crescent Valley. If there's any questions I can answer about these projects.
Are there any questions of the public or the board about these projects?
Mr. Chair, I have a question about the first project. This comes out of a different pot of money than we're doing our remodel behind us currently, correct?
Absolutely, sir. For the record, Shannon Ernst. The funds that are doing the remodel currently were for a lab and healthcare expansion under ARPA funds, which expire December of 2026. These are coming from CMS directly to all states receive these funds. So it's a completely different pot of money.
Perfect, thank you.
You're welcome.
Any other questions from the board or the public? I agree with these projects and how they're ranked wholeheartedly. I'm really pushed on one to get done, or when the county originally tried to remodel both those buildings that they purchased, they ran short of funds on one, and when this money became available through another program than what we were under in ARPA funds that the federal government was making available to the rurals, that Shannon told me about, I pushed her to try to even get more than 3.1 million, but this was kind of the max that we were allowed. CNHD needs to be its, lack of a better term, its own operation, and not housed by the county or run by the county or And that's in the better interest of the 4 counties and the city, I think. And this is a strong move to do that. That was the goal originally, and it kind of stopped because it had to stay in the building. And I think the county's probably going to have better use for this building in their own right. And to get back where we were trying to be in the old Penny's building is a good move. And so this 3.1 million there has really long-term effect on Central Nevada Health District is excellent. And so we need to try to do everything we can do to obtain these funds. And when this money was given to the states to give for rural health, it was the first thing that came to my mind is to try to remodel that old building, a historic building that's downtown. And I think the other 2 programs are excellent too. I believe in telehealth. I think it's a way for the rurals to equal health care where we're lacking and may never catch up in rural health without telehealth. I still believe in doctors being everywhere, and will push that as long as I can and have for many, many years, but I believe in telehealth. So I think these are all great, and I wish we can get all the money, and we're pushing every button that I know and that Shannon knows to try to make these funds available to us. So. And we will continue to do so until we're told no. In a nice way, we're doing that. In a diplomatic way, we're doing that. So, any questions? I think I asked by the public or the board. If not, I'd entertain a motion.
Jeb Rowley, for the record, and before the motion, just again, a comment on the OnMed telehealth station. We do look at just recognizing, appreciating the work of the health district and Shannon specifically to look out for that community in particular. It is very challenging for health services in the rurals, and I know everybody knows that. It does feel definitely it's a spot on the map, and those populations are increasingly challenged to have transportation to get out to where those health services are available. So something like this could really be a game changer for that community. Do appreciate the work on that, but also appreciate the ranking and recognize the other needs of the health district with this. And in that, would move forward with a motion to approve the CNHD team to submit the proposed projects for submission to the Rural Health Transformation Program in flex spending round 1, including in ranking number 1, remodel of 290 South Main Street in the amount of $3,100,000 to support future district operational capacity. Number 2, program support for community health workers to expand outreach services in the amount of $250,000. And number 3, lease of an OnMed telehealth station for Crescent Valley in the amount of $1,800,000 for a 5-year term.
We have a motion. Do we have a second?
Mr. Chairman, Bob Erickson for the record. I second the motion.
Thank you both. All in favor?
Aye.
Any opposed? With that, the motion passes. And on agenda item 13 as the recommended board action in that order. We'll go to item 14. Consideration and possible action concerning the amendment of SG 2026-00027-1 in the amount of $225,000 between DHHS, Division of Public and Behavioral Health, and Central Nevada Health District to to update the budget to reflect an increase in funding in the amount of $64,893 to support public health preparedness. Shannon.
For the record, Shannon Ernst. So this grant actually was awarded, and they came back and they provide us additional funding. So we have a new award before you. One of the biggest goals that we're looking at with the increased funding was obtaining a contract to assist with us to complete our public health preparedness plan as it relates to public health. The goal is to work with each community and pool their public health preparedness plans and actually cite those within ours as for public health. And then they could cite ours within theirs if they desire in the future as how you would respond in a public health emergency. So we're looking at using about $25,000 to obtain a consultant to assist. I have great news. We have hired a public health preparedness planner, but based on their location, they cannot start with us until June, I just lost it because I changed dates, it's called 20th. It was supposed to be the 6th, and then I went to the 20th. So June 20th. And we would like to get this done sooner and get it at least started with a consultant. We decided to wait for this individual until June 20th because of the exceptional experience and years of doing multiple things within preparedness. So today I'm just asking to ratify this. My goal will be to obtain a contractor and bring back the contract for ratification due to the fact that it is a time-sensitive matter, and we could not have that for this meeting. It would be a professional service, so we do not have to go out for the public bid process. If there's any questions you have.
Any questions by the board or the public of Shannon or me on this? No questions, I entertain a motion.
Mr. Chair, I would move to ratify the amendment of the SG 2026-00027-1 in the amount of $225,000 between DHHS, Division of Public and Behavioral Health, and Central Nevada Health District to update the budget to reflect an increase in funding in the amount of $64,893 to support public health preparedness.
Dawn Witten, for the record, I second that motion.
Thank you. We have a motion and a second. All in favor?
Aye.
Aye.
Any opposed? Being none opposed, that motion carries on item 14, and this amendment in the amount of $225,000 has been approved. We'll go to item 15, consideration and possible action concerning ratification of subaward SG-2026-00249 in the amount of $5,708 between DHHS, Division of Public and Behavioral Health, and Central Nevada Health District to fund activities to reduce and eliminate the transmission of Mycobacterium tuberculosis as per the Nevada Administrative Code 441A and Nevada Revised Statutes NRS 441A, and the guidance of the Centers for Disease Control and Prevention within the district. Shannon.
For the record, Shannon Ernst, this is a ratification of award that we've received to really help support, build education around tuberculosis, provide tracing, and increase program development. Overall, within the statute, this is something that not only does Victoria get to trace these and monitor these, but they need to make sure they also are receiving treatment if it's necessary and should be required. So I'm asking for this ratification today.
Is there any question from the board or the public on this? Hearing none, I ask for a motion.
Mr. Chair, Jeb Rowley for the record, with motion to ratify the subaward SG 2026-00249 in the amount of $5,708 between DHHS, Division of Public and Behavioral Health, and Central Nevada Health District to fund activities to reduce and eliminate the transmission of Mycobacterium tuberculosis as per the Nevada Administrative Code 441A and Nevada Revised Statutes, NRS 441A, and the guidance of the Centers for Disease Control and Prevention within the district.
Thank you. We have a motion. Do we have a second?
Nicole Cooley, I second.
There's a motion and a second. Thank you. All in favor?
Aye.
None opposed? There's none opposed. This ratification of this subaward has been approved on item 15 on the agenda. So we'll go to item 16. Consideration of possible action concerning an award of an IT cloud migration, hardware modernization, and managed IT services to Apex Computing in the amount of $95,346 for year one and $55,116 per year for an additional term of 4 years per NRS 331.115.1.b. Shannon.
For the record, Shannon Ernst. As the board knows, we are in a contract with Churchill County to provide certain administrative functions. One of those is IT. We obtained actually funding, when I say we, CNHD, obtained funding approximately 2 years ago, starting with SB 118 and then the Public Health Fund and Fund for Healthy Nevada to help support some of that migration. Previous administrator had gone out and obtained some quotes, but it was really looking at having in-house servers, things of that sort, which technology has come a long way. So we worked with a couple of IT companies to evaluate CNHD's structure, how we have 4 communities, 4 offices, and we need to all work in sync. There was recommendations by both that we go to a cloud-based system. So we did obtain 2 quotes for this, and we found Apex Computing actually meets the needs of Central Nevada Health District based on how they will provide the service, the support, their location, to get to us if we need them. And so today we're asking that we do get authority to award this contract. These funds are all coming from the Fund for Healthy Nevada, first payment, and then we have SB 118. So the time is of the essence of this project. A lot of these funds expire June 30th of this year. So we want to get launched, get everything migrated before July 1. So if there's any questions, I can answer.
Are there any questions of the board for Shannon or the public for Shannon? Being none, back to the board for discussion and/or a motion.
Mr. Chair, Matt Hyde for the record. I move to approve Ward IT Cloud Migration, Hardware Modernization, and Manage IT Services to Apex Computing in the amount of $95,346 for year one and $55,116 per year for additional term of 4 years pursuant to NRS 331.115.1.b and authorize the administrator to execute the agreements.
Thank you. Do we have a second?
For the record, Dawn Witten, I second the motion.
We have a motion and a second. Thank you. All in favor?
Aye.
Any opposed? None opposed, the motion carries. And item 16 on this agenda, this award to IT cloud migration has been awarded. We'll go to item 17, consideration and possible action concerning the review of our fiscal year 2026 revenue, expenditure, and grants to date. Is Shasta on the line?
So, Mr.
Are you
Chair, I
doing that?
apologize, she's not. For the record, Shannon Ernst. And I apologize, today we have extreme short team members. We have an event happening in Mineral County, and we have a couple of people at conference. So I'll be presenting Shasta's as she's helping a tabling at the Mineral County. So before you, you do have your fiscal reviews. We have provided the expenditure report, your revenue report, and then where we're at with our grants. We are on target for all budgets. Our revenue looks a little bit shy based on some permits that are pending and some other reimbursements from grants. But it is on track so that we will meet those expectations by June 30th so that we do not have to use any of our reserves. If there's any questions I may answer or reach out to Shasta and get back to you about.
Are there any questions from the board or from the public that Shannon can answer, or that they would like Shasta to get back to them on? You know, I think it looks pretty good. You know, there's some years there where it was not so good, but it's looking a lot better. Yeah.
The team is working
I mean, at the
hard.
start, it was really kind of difficult to get through, as you know, but it looks a lot better. Any questions? Okay. Do we want to approve this without Shasta here, do you think, or?
Yeah.
Okay. I'll entertain a motion.
Mr. Chair, Jeb Rowley for the record with a motion for consideration, or excuse me, I've got that. I apologize. Motion to approve the review of fiscal year 2026 revenue, expenditures, and grants to date.
Thank you. Do we have a second?
For the record, Dawn Witten, I second that motion.
We have a motion, and a second. Thank you. All in favor?
Aye.
None opposed? None being opposed, the motion carries, and the review so far of the fiscal year 2026 has been approved. We'll go to item 18, staff reports. You're going first, huh? Okay, good.
She always nominates me first. Good afternoon, Mr. Chairman and other members of the board. Victoria Sepsic for the record. I'm going to provide the epidemiology program update for March 2026. It is a little lengthy. I apologize. Shannon tells me to keep it to one page, but I don't really know how to do that, so I'll just speak very fast. In March, the epidemiology program continued monitoring, analyzing, and responding to public health trends across our region. We had no outbreaks to report for that month. For respiratory viruses, we're currently still in respiratory virus season. It does not end until about middle of May. Respiratory virus activity followed expected seasonal patterns and continued to decline. Influenza activity remained low, with 12 cases reported in March, and we had no new hospitalizations since early February reported to us. Season totals include 46 hospitalizations and 4 deaths. so far, with influenza A predominating. RSV activity also declined after a later than expected peak in our season, with 36 cases reported in March and 7 hospitalizations total. COVID-19 activity remains low, with about 10 cases reported and minimal impact statewide and nationally. Our measles surveillance, right now, no measles cases have been reported within our jurisdiction. Surveillance and preparedness efforts remain active, including coordination with state and regional partners and ongoing communication with healthcare providers to ensure rapid identification and response if needed. Our H5N1 surveillance, I'll give a brief update. We've had no activity this season, which is great. My program did deliver PPE, educational materials, eye wash stations, at-home flu test kits, hand sanitizers to any of the dairy farms here in Fallon who wanted to receive these items from us. I think we passed out about 8 farms that wanted to get supplies from us. I continue to do check-ins with our farms to do symptom monitoring and just check in and see if they need anything from the health district, any sort of support. And I do have ongoing meetings with the state veterinarian. I wanted to provide an update to the board that I am presenting an abstract that I wrote for the Nevada Public Health Association. This is for their 2026 conference next week. My abstract was on titled Detection to Containment, a rural local health district's rapid response to the H5N1 highly pathogenic avian influenza outbreak. This presentation is going to describe how CNHD responded to the bird flu outbreak that we had here in Fallon last year, and how we were able to actively monitor over 100 exposed dairy workers to the bird flu over about a 4-month period. I will update you all on the presentation, how it goes, after next week. Yes, we also do have I didn't write that on my paper.
No, but it's exciting.
We're presenting at the Washington the Food and Safety Coalition next month. Our program is going to do an update on Burning Man, how we handle complaints and food inspections. So Maria, our health environmental health manager, is going to help us with a presentation. And that's a national presentation that we'll be putting on next month. I'll have another update for that after that one also. For sexually transmitted infections, reported STI cases, what we monitor and track for our area is chlamydia, gonorrhea, HIV, and syphilis. For March, we had decreased activities from previous months, which is great. Monitoring and case investigations are ongoing to support timely treatment and prevention. For general communicable diseases, routine surveillance continues, with overall case counts being lower than in prior months for the month of March. For all of our cases, I went ahead and provided you in your packet with a summary of all of the reported cases that we have investigated for the month of March. We are currently developing a new public-facing dashboard right now. This will be for respiratory viruses, for surveillance, and also general communicable diseases. This dashboard will aim to improve transparency and access to health data for anybody who would like real-time data on what's going on for trends within our community. So that dashboard is underway right now. Our program also completed 5 heart health classes within the last 2 months. We put on the class in each of the counties. We were able to do a 5th class here in Fallon, actually just on Tuesday. We had really strong community participation, lots of positive feedback. This was on heart attack and stroke prevention. We are actually getting ready to do another class in May. This will be for diabetes prevention. So our goal is to get 50 participants in the 4 communities coming up in May for diabetes. Other than that, we remain committed to protecting public health through all of our ongoing surveillance, our community engagement, and collaboration with our healthcare and regional partners. Do you have any questions for me? Okay, thank you.
Dr.
Okay.
McDonald?
Dr. Ted McDonald, for the record. That took my breath away. Oh, Dr. Ted McDonald, for the record, and again, that took my breath away. I think mine is pretty succinct, and there's a lot of things that are in there that are bullet pointed. If we need to address, I have survived the first month and a half of taking over as a clinical provider, and it has. I've learned a lot from it and understand the workings a little bit better of how clinical services work and the interface between the community, ourselves, and our partners like our laboratories and our electronic medical record system, which sometimes is baffling, but it's workable. We have lots of plans coming up. We've got some, our CLIA certification for our in-house lead and syphilis testing, which we've been working on for the last 6 months. We're now waiting for the state to schedule our inspections so we can add that and have at point testing for it so that we don't have to wait even 2 or 3 days for initial results. We have started our program with Juvenile Probation Office, and that has been also a learning experience for me, but I'm really proud to say that our probation officers and the organization there are a remarkable group of people. I do not often walk into an environment where everybody is on board, on mission, and providing humane and services to our community. So I definitely feel that that's a good program, and I'm happy to be involved in it. And we are working to make it a closer relationship. Shannon and I had a meeting, was it last week? Time flies. So last week or the week before. And it was a good meeting with the people in charge there. So it's a good thing, and thank you for letting us move forward with that. And our remodeling is, I saw patients yesterday in Fallon, so we had enough things in the right places where we could get things done. And Shannon has been kind of like an umbrella. She's all over the place and keeping the rain out and keeping things organized and moving along. So kind of going to, I gave you some weird stuff. So challenges, the challenge is that you can kind of see some of the things that are happening now with the way your grants are coming in and the way we wind up having timelines that are so crunched. And that's because of the volatility of the way funding is provided from the federal government. When things are taken away and brought forward and taken away and brought forward, it winds up creating a crunch for writing grants, making the deadlines that are now new deadlines to be able to use the money. So when you see that, it's like, well, why aren't you guys thinking ahead? And we are thinking ahead. It's just we don't get the go-ahead to be able to access the funds, or they may not, sometimes they become not available. I threw in a comment about the Anaconda Mine in Yerington. They are about finished with their cleanup. They never became a Superfund. They missed that, they avoided that process. But now that cleanup is nearly done, there are still mineral deposits throughout the county. They are now confronted with environmental concerns is the main thing. It's like water, power, usage, waste, all those sort of things. And this will be something that we'll see a little bit more of in the future. I don't know how much it affects us, other than I always am concerned about things that happen in our watershed that are above us for the future of the community, looking at what sort of, is that going to affect our water resources and our, our ability to grow. The state of Nevada is expanding their laboratory, so they're going to be doubling their space in the next few years, and that'll be up on the UNR campus in that area. So that's going to help us a lot by having more availability for their lab services, which are a lot quicker than a lot of the services that we use with some of the other labs. And they're also really easy to get a hold of and talk with. We did have our University of Nevada School of Medicine had the Rural Outreach Clinic on the 12th. It was successful. We saw a lot of people there. In May, students from the University of Nevada and myself will be going to San Diego, and we're going to be going to the National Rural Health Association meeting. It's their annual Rural Health Conference and Rural Innovation meeting, and we will be presenting to them regarding having rural outreach clinics and their effectiveness in the rural setting. And I'm open for questions on everything else.
Are there any questions? Are there any questions from the public of either of these two that presented? Okay, thank you.
Thank you.
Mr. Chair, if I can just add a couple of things, because based on the fact that Maria Montevera is not here today, she is at conference, you do have her report present within your packet, and then also you have the clinical report. I just want to provide you a quick update on staffing. We're excited. We offered, and many don't know this yet because I just found out as I walked in here, we offered and a position has been accepted for the resource liaison in Eureka. This is something we have been trying to fill for over a year, so we are very excited. Also, we received 2 applications for the APRN clinical manager, and myself, Dr. McDonald, and board member Denise Ferguson will be holding interviews next Thursday. So we're hoping to get those filled. I have been working to get to all the communities. I was in Eureka last week, and I was in Lovelock last week for the LEPC meeting. The week prior, I'd planned to going to the Board of County Commissioners meeting, but as many know, I've had some ill parents in and out of the hospital, and on my way, I had an emergency call, so Maria actually called in and took that for me and provided that presentation. But I am working to get around to see all of our board members, and so if there's any other questions. We have a lot going on. We have our Village Reach community assessment happening. We're very excited about the progress there. They've already made it to Eureka, Crescent Valley, Mina, Churchill, and Hawthorne. Yeah, we still have to go to Lovelock. So that's making great progress, and they're working on our new website also. What am I missing? I don't know, there's a lot.
Okay, thank you. We'll go to 19. We put, I guess Shannon, you can tell them, but we put a list of proposed meetings. I guess the agenda calls it scheduling of next Board of Health meeting, but we put a list down there for the entire year of proposed meeting times. Some can be virtual, some we thought would better if they were in person and virtual if you can't make it. But so take a look at that schedule. The next one on here is May 13th at 1:30 virtual. If you can't make it, always you can come if you want to, but well, maybe not, because I did a virtual one in my office, I remember now that I'm thinking about it. So I guess they are virtual. But look at the schedule and see how it is with your schedules. and then get back to Shannon. But go ahead.
Sorry, for the record, Shannon Ernst. I just want to note a special meeting that we have placed on here, and it's for July 8th. Our goal is to move these meetings into CNHD's new space. It will not be as fancy as this, but the chair and I were discussing, and it's nice to have it in that space. So we will be looking at the platforms with our new IT on the best one, if we do Teams or Zoom in the future. And so we're proposing that on that 8th, we do that at 3 p.m. because we'd also like to invite the board to come and meet the staff and have a dinner here in Fallon and do the ribbon cutting for the new space. So that's a big one I would like to note. And if there's any questions or concerns, absolutely, please let me know.
Yeah, that's the one that we'd like you to come, because we thought it was a time y'all could come meet the staff that work here at CNHD, and because I don't think, I don't even know everyone on the staff, so I thought it would be good for even me, but and this isn't the $3.1 million area. This is just this temporary place that we're still in the county's building, Matt. So, and Matt knows where the spot is and where they're providing it, and it will be like crowded. Maybe not quite as crowded as when we had the one before in the conference room outside the manager, Chris Ross's office. That was really crowded. And some of you were on the TV that day too. But it will be like our space instead of like in here, and it will be around a conference table, and there'll be that, and the public can still come, and that wishes to, and of course Leanna can fit in there. But we're trying to be CNHD and not, some people think we're a county organization, much to Matt's chagrin at times. But so maybe when we get back in this corner somewhere, we'll be more like that. So that's July 8th at 3, I'm sorry. So that one kind of is locked in. So don't go very far after the July 4th celebrations. And the other ones, look at your schedule and see what Shannon came up with. I haven't even looked at mine, to be honest with you. But so with that, we'll go to item 20 for public comment. Anybody out there have any public comment? You have anything, Lane? You've been sitting in there being pretty quiet all day. Okay. All right, then we'll go at item 21. We stand adjourned. Thank you very much.
Thank you.